Radio Health Journal. I'm Nancy Benson. This week, many of us encounter rudeness every day. Why is that? Is it because rudeness pays?
You're always going to have outliers, but I think that there's very strong research within organizations that shows that 3 out of the top 5 tie to rudeness or incivility.
Why is rudeness spreading? When Radio Health Journal returns.
I'm Reed Pence, host of Radio Health Journal. If you enjoy Radio Health Journal, you'll also like our sister show. Here's a preview of what they're covering on Viewpoints this week.
This week on Viewpoints.
A lot of our stories have a lot of darkness and violence in them, just as the real world has. It also depicts young people at the forefront of changing their societies for the better.
How young adult fiction can help our teens confront some big topics. Then,
is to try and reduce that stigma of hearing voices, to see it as a part of human experience, and it just needs to be understood better in its amazing variety.
The history and science of how we talk to ourselves. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station, iTunes, and Stitcher.
Ten years ago, 2 colleagues in higher education were in a heated debate about a surprising topic, the effects of rudeness. One of them claimed that rudeness doesn't pack much of a punch. People encounter it often and get over it quickly with no ill effects. The other colleague believed that people are much more affected by a rude encounter. So they made a bet, then conducted some studies to prove who's right.
And I discovered very, very quickly, and many studies later, that she was right and I was wrong about it. We published 2 studies, actually one about experiencing rudeness, and the other one was about even witnessing rudeness. And we found that it influenced their performance on cognitive tasks. So people basically cannot think well. Then I conducted other studies that show that it directly influences our cognitive system. So people cannot function when they are being insulted.
That's Dr. Amir Erez, professor of management at the University of Florida Warrington College of Business. His colleague, who said people are profoundly affected by rudeness, is Dr. Christine Porath, associate professor of management at Georgetown University's McDonald School of Business, and author of Mastering Civility, a manifesto for the workplace.
Even when people are just around rudeness, so it doesn't have to be that they experience it or even witness it. If they're working in a culture or primed with it somehow, then they are far less likely to perform as well. They're less creative. They're also less attentive to information, and they process information more slowly. Unfortunately, it's very prevalent and it's growing. So over the last couple decades, I've seen a rise in it within organizations in particular. So I think it's a problem that unfortunately we have not tackled.
Porath has conducted several studies to track the spread of rudeness. Her first, in 1998, showed that only a quarter of people experienced a rude encounter at least once a week.
And then when I performed the survey again in 2005, that number had risen to nearly half. When I repeated it again in 2011, it was more than half.
And today, many of us encounter rudeness every day. Why is that? Is it because rudeness pays? Sometimes it seems that rude people get ahead in the world. But Porath says, for the most part, rudeness does not pay.
You're always going to have outliers, but I think that there's very strong research within organizations that shows that 3 of the top 5 reasons people fall off of their career or success, the Center for Creative Leadership has found 3 out of the top 5 tie to rudeness or incivility. So I think that there's strong evidence from multiple sources that show that rudeness does not pay, and in fact, my most recent research has shown that civility pays.
Porath says that whether you're an MBA, a member of a consulting firm, or an employee at a biotech company, if you're polite and civil, others will perceive you as a leader.
People were much more willing to share and seek information from them, and people perform better. So, for example, in the biotech firm, those that were perceived as more civil performed 13% better than others, as rated by bosses.
But if being civil can help you get ahead in the world, why is rudeness spreading?
Over the years, I've realized that it's really about a lack of self-awareness for the vast majority. 4% say they're rude because it's fun and they can get away with it, but I think the majority, they're simply not aware of how they're perceived by others. So getting them feedback about the effects that they're having on their employees and peers and so forth is really a crucial step.
Porath says another reason for rudeness is stress.
I think that that's a big issue for most people is attentiveness now. Just we're being pulled in a lot of different directions. So when I've surveyed people about why are you uncivil, the number one answer by far, over 60% of people say because they're overwhelmed or stressed. Many will report they don't have time to be nice.
But if getting ahead isn't enough to convince you to be polite and civil, here's a sobering fact. About 250,000 people die annually from medical errors. Factors such as sleep deprivation account for a portion of those errors, but ERAS found that being the victim of someone who's rude, or even seeing it happen to someone else, can account for even more of them.
For example, you think that residents' sleep deprivation will explain a lot of medical error, and it does, like around 20%. But in our studies, we found that these small insults, they explain 40% of the reduction in performance.
Small insults in the OR, for example, may reduce a person's cognitive abilities and their ability to pay attention, even to things that are right in front of them.
What happens in medical setting where you have somebody in surgery, and let's say that the surgeon insults the anesthesiologist, and the anesthesiologist is missing critical information that is in the center of their visual field. That happens very, very often in medical settings. And in the first study, we found that it's devastating to performance. And in the second study, we found that when patients are rude, it has the same effect. And this is what I'm finding also consistently in my studies, that it doesn't matter even if you do not experience it, if you just witness it, the effects are the same effects on our cognitive system.
So when you're the patient, even though you might be feeling angry or frightened or under a lot of stress, you definitely don't want to take it out on your doctors and nurses by being rude to them.
Or it could be that they think that they actually can get more, from the doctors, if they're being rude. And if this is the case, what we are finding that it actually has the opposite effect. And it's not only that they are damaging the treatment of their own children, but also of other patients. Because in this study, in the second study, what we found is that it lasts throughout the day when they treated 5 other patients. So now we need to start thinking about how to help doctors and nurses get over these effects, because this is going to affect people's lives.
There's a quiz on my website that gives 32 suggestions for how civil are you and ideas for how to improve your civility. So, I think that is one resource for people. But, I think it starts with the basics, saying please and thank you, smiling at people, acknowledging people. So if you're a leader, you acknowledge people, you give out credit, you show gratitude towards others. So, that's worth the investment, and things like that. Listening, I think, is probably the biggest thing now that people struggle with, that I would say is fundamental. Very hard to be attentive given how we're tethered to our phones and always kind of being on as far as technology. So I think that that's one of the biggest challenges to showing up and treating people respectfully nowadays.
And since we usually can't control someone else's rudeness, Porath says the best strategy is to focus on our own behavior.
For example, if this is taking a toll on you, identifying areas for growth and pursuing your own development such that you're building yourself up. I think it's very important that people take care of themselves, so managing their energy, whether that's sleep, exercise, good nutrition, stress management. I think it's very important for people to find meaning or a sense of purpose in their work, and also to seek positive relationships. We know that these negative or de-energizing relationships really pull people down. They have a much stronger effect than positive relationships. So thinking about building up your reservoirs of support and positive relationships is great. And then also focus on thriving outside the workplace. That's a really important element because you will bring the positive energy and sense of moving forward back into your professional life.
And just as rudeness is contagious, Porath says, so is civility. You can learn more about Drs. Amir Erez and Christine Porath and the book, Mastering Civility, by visiting our website, radiohealthjournal.net. Our writer-producer this week is Polly Hansen. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
The burden of Alzheimer's disease on the nation's families and economy is growing rapidly. The Alzheimer's Association 2019 Alzheimer's Disease Facts and Figures Report finds that an estimated 5.8 million Americans are living with Alzheimer's dementia, and 1 in 3 seniors will die from it. More than 16 million Americans are caring for a person with the disease. Dr. Keith Fargo is Director of Scientific Programs and Outreach at the Alzheimer's Association.
Alzheimer's is now the 6th leading cause of death in the U.S., and by 2050, the number of Americans with Alzheimer's is going to climb to almost 14 million. This burden to the country and the families is unsustainable, and it's critical that we continue to invest in Alzheimer's research to reverse this trend.
Fargo says in 2019, Alzheimer's disease will cost the country $290 billion. And without scientific advancements, that figure will top $1 trillion by mid-century. Learn more about the impact of Alzheimer's disease at alz.org.
Individuals and businesses with tax problems, listen carefully. Do you feel like you're losing control of your finances? If you owe over $10,000 in back taxes or have unfiled tax returns, we can help you take back control. The IRS is the largest and most aggressive collection agency in the world, and they can seize your bank accounts, garnish your paycheck, close your business, and file criminal charges. Take control of your tax problem now by calling the experts at U.S. Tax Shield and take advantage of the Fresh Start program and new laws that may allow us to negotiate a settlement for the lowest amount possible. Our team of tax attorneys and enrolled agents can stop collections and get you protected so you can take control of your financial future. U.S. Tax Shield offers a price protection guaranteed quote to get you protected today. U.S. Tax Shield is A+ rated with the Better Business Bureau, so call now. 800-568-1647. That's 800-568-1647. U.S. Tax Shield. 800-568-1647.
What are you going to do with your old car? You can try selling it, you could junk it, or you can donate it to Heritage for the Blind. Your car will be towed away for free, and your donation is tax deductible. Just call 1-800-835-1478. Heritage for the Blind accepts cars, vans, trucks, and boats. It doesn't matter if your vehicle runs or not. It will be towed away for free, and you'll be supporting those that need help. Heritage for the Blind is a nonprofit organization that helps the visually impaired live fuller lives. Call right now to donate your car, and as a special thank you, you'll receive a free 3-day vacation voucher to over 50 locations. Call Heritage for the Blind right now. Call 1-800-835-1478. Donating is easy, and your vehicle is towed away for free. Plus, you'll get a free vacation voucher for donating. Call now, 1-800-835-1478. That's 1-800-835-1478.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this week's show, please leave a review on iTunes or share it with a friend. You can find more Radio Health Journal stories about health, science, and technology on iTunes, Stitcher, and at radiohealthjournal.net.